Hello, my name is Lorena. Today I'm going to be doing a neurological assessment and a musculoskeletal assessment. Matthew's here to help us do these assessments. So I'm going to start with the neurological assessment. First, I will assess his mental status, and I can see that he is alert, he's awake. And then next I'm going to move on to testing the cranial nerves. And I'm going to start with cranial nerve number 1, which is this olfactory one. I'm going to test the smell. So Matthew, I'm going to ask you to close your eyes, and I'm going to give you something to smell. And you're going to tell me what you are smelling, okay? Can you close, close one nostril there. And I'm going to give you this to smell. You're going to tell me what it is.
Vanilla.
Okay, and that is accurate. You can open your eyes now. Cranial nerve number 1 is intact. And then I'm going to test cranial nerve number 2, which is the optic nerve. That involves testing the acuity of his vision. We would normally do the Snellen chart, which we already did. And I'm also going to test for peripheral vision as well. So I'm going to ask you to look at my face and close one eye like this. And I'm going to wiggle some fingers on the sides, and you're going to tell me when you see them, okay? And just look straight at me.
I see him. I see him. Yep. Yep.
Okay, perfect. Peripheral vision is intact. Cranial nerve number 2 is intact. Now I'm going to go on to testing cranial nerve number 2 and 3, which is the optic and the oculomotor. So I'm going to start by inspecting the pupils. Alright, so they're going to just look straight at me. I'm going to shine the light. Okay. Okay, and I'm just checking for the symmetry of the pupils of the eyes. In his eyes, the pupils are equal, reactive to light and accommodation. Now I'm going to go on to testing cranial nerve number 3, 4, and 5, which is the muscles of the eyes. So I'm going to ask you to just follow my finger, okay? Okay, and I can see good movement of the eyes following my finger. And I'm also going to test for convergence. I'm just going to ask you to follow my finger now as well. Okay, perfect. And I can see convergence there as well. Next, I'm going to assess cranial nerve number 5, which is the trigeminal nerve. So that tests the muscles of your face and the sensory nerves of the face as well. So I'm going to palpate your temporal area first here. I'm going to ask you to clench your teeth for me. I can feel good movement there, and then I'm going to feel your masseter muscles here. Perfect. Alright, I can feel good movement of the face. That's intact. Now I'm going to go on to testing the sensory nerves of the face. And I'm going to do that by using a dull and a sharp end. So I'm going to show you first what dull feels like and what sharp feels like. This is dull. This is sharp. Okay?
Sure.
So I'm going to ask you to close your eyes and to tell me what you feel, dull or sharp, okay?
Dull. Sharp. 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 Dull. Dull.
Okay, perfect. You can open your eyes. And there is good sensation in the face and good muscle movement of the face. So cranial nerve number 5 is intact. Now I'm going to go on to testing cranial nerve number 7, which is the facial nerve. So I'm going to ask you to raise your eyebrows. Now I'm going to ask you to smile. Now frown for me. Like this. Like a mad face. Okay, perfect. Now I'm going to ask you to close your eyes tightly. And I'm going to try to open them and don't let me, okay? Okay, perfect. And there is good muscle movement when I was trying to open his eyes. This cranial nerve is intact. Next, I'm going to do cranial nerve number 8. This is the acoustic nerve. So I'm going to test for hearing. I'm going to start by doing a whisper test. I'm going to ask you to just put one finger in your other ear. And I'm going to whisper something. You're going to tell me what you hear, okay?
2, 3, 4.
Okay, perfect. So he passed the whisper test. Now I'm going to do Ryan's test. So this just checks for air and bone conduction. So I'm going to put this right behind your ear. You're going to tell me when you stop hearing it, okay?
Okay.
Okay. Tell me when you stop hearing it.
Okay.
Okay, perfect. And bone conduction is less than air conduction. Now I'm going to do the Weber's test. This is just checking for lateralization. So I'm going to put this on your head. You're going to tell me if you hear it more on other ear than the other or just equal, okay?
It's equal.
Equal, okay, perfect. All right, cranial nerve number 8 is intact. Now we're going to do cranial nerve number 9 and 10 is the glossopharyngeal and the vagus nerve. So I'm going to check your mouth. I'm going to ask you to say Okay, you can close now. And I'm just checking for movement of the soft palate and the uvula rising, which I was able to see that. I would also check gag reflex and just checking for movement of the soft palate as well. Next, I'm going to do the cranial nerve number 11 is the spinal accessory. So I'm going to ask you to just shrug your shoulders against my hands. Okay, perfect. And he has good strength. That cranial nerve is intact. And finally, I'm going to do cranial nerve number 12. This is the hypoglossal. It is just checking for the nerves on the tongue. So I'm going to ask you to stick out your tongue. Just move it side to side. Perfect. And I can see that the tongue is symmetric and it has symmetrical movements upon moving. Next, I'm going to move on to testing the motor nerves. So I'm going to ask you to just stand right over here. And I'm going to ask you to just walk this way to the wall and backwards. Come this way. Okay, perfect. So I'm just checking for the swing, the position he's walking, and he's walking with good position. Now I'm going to ask you to just walk with your heel in front of the other, moving forward, checking for balance. Move this way. Perfect. And I can see that he has good balance. Now I'm going to ask you to put one leg up, stand on one foot first, now on the other. Okay, perfect. All right, and you have good balance. Now I'm going to do what's called Gumberg's test. So I'm going to ask you to close your eyes for me. Just checking for balance. And a few movements is normal. Okay, you can open your eyes now. Now I'm going to do the pronate or drift. I'm going to ask you to put your arms in front of you with your palms facing up. All right, now close your eyes. Okay, and he has good balance. All right, and there's no pronate or drift. I can't see him pronating his arms, so. All right, you can open your eyes now. All right, I'm gonna ask you to sit down. And I'm gonna do a rapid alternation movement test. So I'm basically checking for coordination. I'm gonna ask you to, with both your hands, just do this. up and down and up. Now do it fast. Okay, perfect. Now there's well coordination there. Now I'm gonna ask you to, you're gonna touch your nose and you're gonna try to reach for my finger, touch it, and go back. And do it fast. Very good. Now close your eyes and do the same thing. Okay, good. Now I'm gonna ask you to do the same thing. And touch my finger. Okay, very good. So there's good coordination. He's able to follow my finger with movement. Now I'm gonna ask you to just sit back a little bit more. Perfect. And I'm gonna ask you to just slide your foot down to reach your toe down. Okay, now do it when you're with your other. Okay, and I can see coordinated movements with smoothness and accuracy. Okay, so that completes the motor system. Now I'm gonna move on to the sensory system. So we're going to do again testing for dull and sharp. All right, I'm gonna try it on different spots and I'm gonna show you again what dull and sharp feels like, okay? I'm gonna have this arm. So this is dull, this is sharp, okay? Now you're gonna close your eyes. You're gonna tell me what you feel, okay?
Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Perfect. You can open your eyes. All right, and he is able to distinguish well dull and sharp in different areas of the body. Now I'm gonna go on to testing just light touch. So I'm just gonna show you how it feels, so you can distinguish. Like that. Close your eyes, and you're gonna tell me when you feel the touch.
Yep. 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 Yep.
Okay, perfect. So he has good sensation and he's able to feel light touch. Now I'm gonna do vibration. Alright, so I'm gonna ask you to close your eyes and you're gonna tell me when you feel the vibration and when you stop feeling the vibration, okay?
I feel it. I can't feel it.
Okay, perfect.
I feel it. Can't feel it.
Okay, perfect. Okay, that's intact. He can distinguish with vibration. He can distinguish when he feels it and not. Now I'm going to go on to doing proprioception, it's called. So basically I'm just going to grab his toe, move it in different directions with his eyes closed, and he has to tell me whether he knows if it's upwards or downward. Alright, so eyes closed. Grab your finger, your toe here. Tell me if it's up or down.
Up. Down. Down. Up.
Okay, perfect. Alright. And now I'm going to go on to testing discriminative sensations, which we call stereognosis. So basically we give him an object and he has to distinguish what it is with his eyes closed. So close your eyes again. I'm going to give an object and you're going to tell me what it is.
Feels like a coin. Feels like a quarter.
Okay, perfect. Alright. And that's good sensation. Now I'm going to do what's called graphesthesia. So I'm going to draw something on your hand, on the palm of your hand, and you're going to tell me what you feel with your eyes closed, okay?
3.
Okay, perfect. Yeah, so he was able to distinguish the number that I put on his palm. And finally, I'm going to do 2-point discrimination. So basically, I'm going to touch with a sharp object that has two ends that are pointy, and he has to distinguish whether it's one pointy end or 2. So I'm going to ask you to close your eyes again, and you're going to tell me whether you feel 1 or 2 ends, okay? You feel 1 or 2?
Feels like 1.
Okay.
2.
Okay, perfect. And usually takes a little longer to feel the 2. Usually less than 5 millimeters. So he was able to feel the 2 ends with an appropriate measurement. Now I'm going to go on to testing the reflexes. So I'm going to start with the biceps reflex. Alright. So I'm going to put my thumb here. Alright, and I can see some movement there. Now I'm going to test the brachioradialis reflex. Okay, and I can see slight movement there. Alright, now I'm going to go on to testing your triceps reflex. I'm going to bend your elbow. Alright. Okay, perfect, and I can see a +2 reflex there. Now I'm going to test the patellar reflex here. Okay. Alright, and that's a +2. Now I'm going to check the Achilles reflex. And I can also feel a slight plantar flexion. And I'll give it a +2. Alright, so now I'm going to move on to the musculoskeletal system. So I'm going to feel first for your head. Just going to palpate it. Making sure there's no any pain when I'm pressing on your head.
No.
No? Okay. Alright, now I'm going to ask you to open your mouth and close. Okay, very good. Alright, and I can feel a little bit of clicking when he's moving his jaw. I'm going to ask you to move your jaw side to side. Okay, now you're going to protrude your jaw and then bring it backwards. Okay, perfect. Alright, and then now I'm going to ask you to move your head back and then forward. Okay, now move it side to side. Alright, now look to the sides and look to the other side. Perfect. So he has full range of motion. Now I'm going to ask you to just press against my hand with your head. Now do it backwards. Alright, and he has +5 strength. Now I'm going to check your neck. Just going to palpate it. Feeling for any tenderness? Any pain there?
No.
When I press? Okay, perfect. Now I'm going to have you stand. And you're going to face the window over there. Now I'm just going to check for the spine. I'm checking for alignment. I'm also checking the curvatures on the back, so I can see concavity on the cervical area. I can see convexity on the thoracic area, and I can see concavity on the lumbar area as well. I'm just going to palpate here, back, feeling for alignment. Any tenderness? Any pain?
No.
Okay. No swelling that I can feel?
No.
Okay. So now I'm just checking for symmetry of the shoulders, and I can see that they are symmetrical. And I'm just inspecting also the hips, checking that they're symmetrical, and they are. Now I'm going to do the range of motion of your spine. So I'm going to ask you to stand right in front of the nightstand, looking that way. Alright, now I'm going to ask you to reach for your toes down. Perfect. Okay, you can stand now. Now bring your back trying to bend. Okay, wonderful. Now you're gonna go side to side. Okay, and there is good range of motion. And I'm gonna ask you to rotate side to side. Wonderful. Okay, so he has good range of motion all along the spine. Now I'm gonna test for your, you're gonna test your shoulders. I'm gonna ask you to have a seat. Okay, so I'm gonna ask you to bring one arm up. Okay, now bring it down. Okay, now you're gonna bring it, if you wanna stand for this, bring your arm backwards. Try to reach over on the air like this. Okay, wonderful. Now bring your arm facing with your palm back, like that. Now bring it on your neck. Okay, perfect. All right, you can have a seat. Now I'm just testing for the strength of your shoulders. Now I'm gonna try to push down. You're gonna try to shrug your shoulders. Okay, and he has +5 strength. Now I'm gonna go on to testing the elbows. I'm gonna palpate them, inspect them, and then I'm gonna test the range of motion. So I'm checking for swelling, tenderness, any pain?
Nope.
Okay. Now you're gonna just flex your arms like that. Very good. Bring your palms facing down. That is called pronation. And now bring it up. That is supination. And he's able to do all those movements. He has good range of motion. Now I'm gonna do a strength test here. Bring your arms up like that again. All right, I'm gonna try to push it down and don't let me. I'm gonna try to push her up and don't let me. Okay. And he has full range of motion of elbows and +5 strength. Now I'm gonna go on to inspecting the wrists. So I'm gonna check the range of motion and I'm gonna palpate. Checking for swelling, tenderness, any pain?
Nope.
Okay. All right, now I'm gonna ask you to put your wrist facing down. That is flexion. I'm gonna ask you to put them up. That is hyperextension. Okay, now bring them straight like this. I'm gonna ask you to bring them inward. That is radial deviation. And then do it to the sides. And that is ulnar deviation. And he has a good range of motion of the wrist. Now I'm gonna test for the strength of the wrist. Bring your wrist in front of you, like this. And I'm gonna push you, you're not gonna let me, okay? Perfect. All right, and that's +5 for strength of the wrist. Now I'm gonna go on to the fingers. So I'm gonna feel your fingers here. Checking again for swelling, tenderness, or any abnormalities. Any pain when I'm pressing on each one of them?
No.
Okay. All right, now I'm going to ask you to make a fist. That would be flexion. Now open your hand. That would be extension. Now I'm gonna ask you to spread your fingers like this. Okay, that would be abduction. Now you're gonna flex your thumb inward like that. Perfect, and that's flexion of the thumb. Now I'm gonna do some strength tests. So spread your fingers like that. I'm gonna try to bring them together and don't let me, okay? Okay, good strength of the fingers. Now you're gonna make the okay sign for me like that. I'm gonna try to bring it apart and don't let me, okay? Wonderful, okay. So he has +5 strength and full range of motion of the fingers. Now I'm gonna go on to testing the hips. So I'm just gonna ask you to please lay down here. Okay. Okay, lay facing this zone like that. Perfect. So I'm gonna palpate the hips, checking for any abnormalities, any swelling or tenderness, any pain when I'm pressing.
No.
Okay. So now I'm gonna test the range of motion. So bring this leg up straight as much as you can. Very good. You can bring it down. Now you're gonna bend your knee and bring it towards your chest. So this would be a flexion of the knee and the hip, which is able to do quite smoothly. Now I'm going to ask you to bring your leg towards the side, so outward, and I'll bring it across your body like that. Okay, perfect. So he has good range of motion of the hips. Now I'm going to go on to just checking the strength of the legs. Bring your leg up like that. And now push upwards towards my hand. Now push down. Okay. And he has +5 strength of the legs and full range of motion of the hips. Now I'm just going to check for swelling of the knees. Any pain when I'm touching you there?
No.
Okay. Checking on the ankles, the same. Any pain?
No.
Okay. Now I'm going to ask you to point your toes. Now bring it towards you. Okay. I'm going to check the strength. Push down. Okay. Now push up. All right. And he has +5 strength. And now I'm just going to ask you to sit on the edge of the bed. And now push against my hand. And now push down. And I'm checking for the knee strength here. Now I'm going to ask you to, I'm going to do a test that tests for carpal tunnel syndrome. So I'm going to ask you to put your hands together. And I would do this for 60 seconds. And if he develops any numbness and tingling, that would mean that's a sign for carpal tunnel syndrome. Any numbness at all?
No.
Okay. Now the second test, I'm going to test right here, the Tinel's test. So I'm going to just tap lightly. And if he feels any numbness, that would also be an indication. Any numbness?
No.
Okay. Perfect. And that completes the test.